Okay, let's talk about something that could be the most critical information you ever learn: how to survive a heart attack when you're all by yourself. Especially for anyone over 60, these next few minutes could literally be life-saving. So let's get right into it. Just imagine that for a second. You feel that awful, crushing weight on your chest. Maybe your arm goes numb, and then that wave of terror hits you when you realize you're completely on your own. This isn't some rare thing. It happens to over 380,000 Americans every single year. The real question is, what happens next? What do you do? So what's this number all about? 73%. This is an incredible amount of power you have in your hands. A study in the European Heart Journal found that's how much seniors can boost their survival chances just by knowing what to do in the first 60 seconds. That single minute can literally be the difference between life and death.
But here's the real shocker. That same research, it showed that a whopping 89% of people over 60 are completely unprepared for this. They freeze up, they panic, or worse, they do things that actually make the situation worse. We are going to change that starting right now with a countdown of 7 essential life-saving tips.
All right, let's kick off our countdown at number 7. This is the absolute foundation for survival. It's all about setting things up before an emergency. Because let's be honest, when your body is in crisis, your brain is not going to be thinking clearly. So why is this stuff so important? Well, when your heart is in trouble, oxygen deprivation hits your brain almost instantly. Studies show that under that kind of stress, a lot of people can't even remember their own address. It sounds crazy, but it's true. That's why you need it written down. Program 911 as speed dial number 1, because one button is a whole lot easier to hit than 3 when you're dizzy and confused. And please, wear that medical alert device even in the shower. That's actually a really common place for these things to happen. Okay, moving on to tip number 6. This is a technique that can buy you precious seconds. It's called cough CPR, and it can help keep blood flowing to your brain if your heart starts beating irregularly. A study from Ping Union Medical College found it actually helped patients stay conscious for about 92 seconds longer on average, and that's more than enough time to make that critical call or get to your medication. So let's walk through this carefully. The moment you feel symptoms, here's what you do. Take a breath as deep as you possibly can. Really fill your lungs. Then you cough, hard, from deep down in your diaphragm. The rhythm is what matters. Deep breath, hard cough, every 2 seconds. You are basically becoming your own heart pump. Now remember, this is a temporary bridge. Its job is to keep you conscious while you wait for help. It is absolutely not a substitute for calling 911.
Coming in at number 5 is a tip many of us have heard of, right? Taking aspirin. But, and this is a huge but, what most people don't realize is that how you take it can make it work up to 50% faster. And in a heart attack, every single second counts.
And this slide just lays it out, clear as day. Research from UC San Diego found that if you chew an aspirin, it gets absorbed into your bloodstream right through the lining of your mouth in just 14 minutes. If you swallow it whole, you're waiting 26 minutes for your stomach to break it down. That's a 12-minute difference. 12 minutes when your heart muscle is literally dying.
So let's be absolutely crystal clear on the protocol. The dose is 325 milligrams, and you have to chew it. I don't care if it's coated, I don't care if it tastes awful, you chew it. And this is critical. Even if you already take a low-dose aspirin every day, you still need to take this full extra dose. Now, of course, this is only if you're not allergic and your doctor hasn't told you otherwise because of other medications like blood thinners.
At number 4, we have something that seems incredibly simple, but it's a powerful strategic tool: your body position. Just getting into the right position can seriously ease the strain on your heart and improve blood flow, buying you precious time. This is the position you need to know. It's called the semi-Fowler's position. Basically, you sit down, you lean back against a wall or some pillows at about a 45-degree angle, and you bend your knees. Whatever you do, do not lie flat. Lying flat makes your heart work harder. This position uses gravity to help you out, and it makes breathing easier. In fact, a study from Tokyo Medical University found it can improve your oxygen saturation by up to 35%. All right, tip number 3 is all about fighting your body's most dangerous instinct in a crisis: the urge to panic and start gasping for air. That panic response, that hyperventilating, it actually makes everything worse. Get this, a Stanford study found that patients who used controlled breathing had 45% less damage to their heart muscle. That's huge. So here's the method. Breathe in slowly through your nose for a count of 4. Then hold it for a count of 4. Now here comes the most important part. Breathe out very slowly through pursed lips, like you're blowing out a candle, for a count of 6. That long exhale is the secret sauce that calms your entire system down. A good way to check if you're doing it right is to put one hand on your belly and one on your chest. You should only feel the hand on your belly moving up and down.
Okay, our number 2 tip addresses a terrifying, deadly obstacle that most people just never consider, a locked door. Think about it. The paramedics arrive, they're right outside, but they can't get to you. It's such a simple problem, but it has devastating consequences.
Just look at this timeline. A study found that a locked door delays treatment by an average of 11 minutes. 11 minutes. Now, when you realize that most people lose the ability to walk within just 3 to 5 minutes of a major heart attack, you can see why that 11-minute delay is so often fatal.
So here is the crucial takeaway. The moment you feel symptoms, your single most important first action is to get yourself to the front door and unlock it. Do this before you call 911, while you can still move. Then you can focus on other things, like getting a lockbox for the fire department or taping your medical info to the door for when help finally arrives.
So, we've covered 6 powerful techniques. But the research has shown that there is one single action that stands head and shoulders above all the others. An action that can give you the same odds of survival as if a paramedic was standing right there next to you.
And here it is, the number 1 absolute best life-saving action you can take is the immediate, and this is key, the correct use of nitroglycerin. So many people who have a prescription for it just don't use it properly in an emergency, and that's why following this specific protocol is so vital.
And this is the jaw-dropping finding from Harvard Medical School researchers. When you use it correctly, within the first 3 minutes of your symptoms, nitroglycerin gives you that astonishing survival advantage. How? Well, it rapidly opens up your blood vessels, which takes a massive load off your heart and can literally stop a heart attack right in its tracks. Now, this protocol has to be followed precisely. First thing, sit down. Nitroglycerin can drop your blood pressure fast, so you don't want to fall. Place one tiny tablet under your tongue and just let it dissolve. After 5 minutes, if you're still feeling symptoms, take a second one. Wait 5 more minutes. If they still haven't gone away, you can take a third and final tablet. It is absolutely critical to never take more than 3 tablets within a 15-minute window.
Look, knowing this stuff is useless if you aren't prepared. So here is your action plan. Do this today. If you have any cardiac risk factors at all, talk to your doctor about getting a prescription for emergency nitroglycerin. Set up that communication system we talked about. Practice the breathing technique. And please share this information with your family and neighbors. You could honestly save a life.
So at the end of the day, it really all comes down to this one question. Knowing these 7 techniques can dramatically shift the odds in your favor, but you have to be prepared to actually use them.